Brian Chernicki, who's our Department Chair of Breast Cancer at Moffitt Cancer Center. Thanks, Brian, for being here.
Thank you, Pat. It's a pleasure to be here.
Brian, tell me about what's going on recently with breast cancer therapeutics. There's different kinds of breast cancer, right? And the therapies are changing rapidly.
Yes, it's hard to keep up with, actually, with the new advances that come for each subtype. So the most common type is the hormone receptor or estrogen receptor positive group, which accounts for about 75% of breast cancers. In that field, the most exciting changes have been these CDK, or what they call these cyclin inhibitors, that are added with anti-estrogen therapies. And they've dramatically improved survival in patients with metastatic hormone receptor positive breast cancer in the order of months to years. There's also been some identification of mutations, different receptors and molecules that are important in regulating the growth of breast cancer that actually are mutated. And so there's a couple new antibody treatments that have been added targeting these molecules that are mutated in breast cancer, and they've added some survival distance. And then in the HER2 field, the antibodies and the targeted therapies against HER2, the molecule that causes the growth of those cells, has dramatically improved. This tumor used to be one of the worst survivals in breast cancer, period, and today is one of the better.
So tell us about your dendritic cell vaccine. I know you've been working very hard on that.
So the dendritic cell vaccine is a hybrid. It's a cross between a vaccine and a cell therapy. We can use it as a vaccine by just giving either peptides or little portions of tumor antigens to it, and they can be injected into the body, and it's a natural vaccine immunity that can be developed. But these cells are also little factories, and they make other little molecules that activate other parts of the immune system. And what we found is by injecting them into the tumor itself, we unlock a whole set of other immune parameters that gets activated. And currently, we're injecting HER2 pulsed dendritic cells made from their own patient back into their breast tumor before giving them chemotherapy. And it drives a wild immune response in their breast and helps the Herceptin and Perjeta antibodies actually create more complete responses.
CAR T cells. There's been a lot about T cell therapy and CAR T cells against lymphomas. Do you see that a CAR T could be developed against breast cancer?
I think the potential will be, once we identify some of these antibodies against some of these mutated proteins, it may be possible to create CAR T cells.
So if someone wants to get on one of your clinical trials, are they open right now? And which patients are you enrolling right now in your
clinical trials? So we're currently enrolling for HER2, and then we have 3 others that will open by September 1st. One for HER2, one for triple negative, and then right behind it, we have one that's for brain metastasis and CNS, or what we call leptomeningeal disease, which is a horrible endpoint of breast cancers, actually given the dendritic cells into the spinal canal to the area where the tumor is.
And what about screening? When should women start screening? What kinds of screening should they get? Because I know there's mammograms, but there's also, with certain kinds of breast tissue, there should be other means of screening as well. And that's why people need to go to specialized places for their screening.
Yeah, so for screening, we actually personalize that here based on your risk. So if you're an average risk woman, you should start getting mammograms at age 40, and either yearly or every other year. For those that are found to be a higher risk, there's also additional screening that can be done, either with ultrasound or MRI. Now, MRI has a new rapid MRI. So the normal test takes about 30 minutes in an IV. This one now takes 10 minutes. You can get a quick screening MRI performed, which is a high sensitivity and specificity. There's ample screening tools available to women, and I encourage all to keep getting screened.
Wonderful. Dr. Brian Chernicki, Chair of the Breast Cancer Department at Moffitt Cancer Center. Thanks so much.
Thank you, Pat.